Thank you for joining me for this episode. I'm excited to be joined by Dr. Kaleb Abbott. We're going to be speaking about burnout in optometry on the OI show. Are you finding that being a business owner in optometry is getting tougher and tougher every single year? Here's the tough truth. For every hour that we spend with patients, we spend 2 hours on administrative work, from charting, working with our team for prior authorizations, inbox messages, and so forth. In fact, up to 70% of our team's time is non-clinical, and patients are feeling this disconnect. I've worked with virtual staffing for over 10 years, and when we started implementing virtual team members into our practice, it changed everything. And then when we found team, everything changed. They helped us choose and support the right people. Now a virtual team handles documentation, prior authorizations, patient communication, phone calls, and scheduling. For more time with your patients, more energy for your team, visit hireteam.com. That's HIRETEEM.com, hireteam.com to get you back in your practice in 2026. Dr. Abbott, it is good to have you back on the podcast. You're becoming a seasoned expert on podcasting with us because of all the incredible different variety of things that we're talking about over the years. But this is awesome. Welcome back.
Yeah, thanks for having me. It does seem that I've been on the podcast a lot lately, but today's topic is much different than anything we've discussed previously.
That is clinically, you're a seasoned expert in ocular surface disease, which is what we like to talk about a lot of the times. But as you may or may not know, and our listeners hopefully are continuing to learn, I just wrote a book called The Invisible Team, and we talk about all of the struggles that are happening in optometry practices.
Amazing.
And the major struggles that many people are dealing with is all of the administrative aspect, right? So we
Oh,
know
yes.
that the vast majority of our time is not spent face to face with clinicians, in fact, or with patients. In fact, about a third of our time is with patients. And
Mhm.
so the Invisible Team was all about how we can kind of help solve some of those. And so many of our colleagues in the medical profession are dealing with burnout. There's survey after survey that are talking about burnout. And in my book, I referenced this really interesting publication that was surveyed of, over 1,400 optometrists that talked about burnout among optometrists, and was really a great article. And then, looked a
That's
little bit
amazing.
closer, and my friend Kaleb Abbott is the first author. So
I
I'm like,
am,
hey,
yes.
I got to talk to you about this. So tell me a little bit about this whole process and this journey of getting even to the point where you're doing this publication about it.
Yes, so I would say I am not a expert on anything professional well-being. I would say this journey for me started because I myself was feeling incredibly burnt out. This was back in really 2023, 2024. I was having a very hard time with work-life balance. I'm a father of three kids now, one kid at that time, and I just found that I was absolutely exhausted at the end of work. I was trying to figure out what is it that I'm doing wrong, and are other people feeling this way too? And so I started doing some research into burnout, and I realized there is no research on burnout in optometry. There's really hardly anything that's published out there. There's never been a national study ever done before. And being a researcher myself that typically does ocular surface disease, I said, well, why don't I stray from what I typically research, and why don't we do the first large scale study on burnout? Why don't we figure out, what percentage of optometrists are affected by symptoms of burnout and what it is associated with for optometrists in the United States? And I will tell you, if you're burnt out and you launch the study on burnout, it does not improve your burnout.
um, well, how do you even know if you have burnout or if you are burnt out? Like, how do you get to the point where you're like, this is burnout, right? I mean, you have this sense of maybe like
Yeah,
not thriving, but like, what is burnout? I guess is kind of a question to start off with.
that's a great question. So, I mean, burnout historically has been classified and characterized as emotional exhaustion, cynicism, depersonalization, or just a diminished sense of personal accomplishment. And it's actually a term that was coined in 1974 by a psychiatrist named Dr. Freudenberger. And he noticed that some of his patients at the end of a long day were so tired that they would light their cigarette at the end of the day and forget to smoke it, that it would just burn out. And so that's where he actually got the term
Ah,
burnout from. But I think one of the first questions I asked myself was, is burnout actually a problem? Because I think all of us as optometrists, we want to work hard, we want to help our patients out, and we know with helping people out, you take on a lot of their problems, and that can lead to burnout. So I think the first question I asked myself, is burnout actually a problem? And it turns out that it definitely is. So it's a problem for practitioners because it increases job turnover, it reduces your productivity at work, increases the likelihood that you're going to commit a medical error. It increases
mm,
malpractice lawsuits for healthcare practitioners. On a personal level, it increases your risk for substance abuse, depression, suicidal ideation, and decreased quality of life. And then it's also a problem for patients too. We know that if a practitioner is burnt out, patients have lower satisfaction and they're less likely to adhere to the medical advice that their practitioners give them. And it leads to worse patient outcomes too.
so, we're going to talk about this survey that you took, which I presume actually answers this question to some degree. But how does one know if it's adversely affecting them? Because there are days that are harder than others, and then
Yes.
there are days that are better than others. So there's obviously a continuum, and right. So when does an IOP become glaucoma? Is
Mm.
when do bad days become burnt out?
That's a really, really good question. I would say it starts with trying to understand the difference between normal stress, which is healthy. Stress motivates us, stress is what pushes us to move forward, stress makes us stronger. When does stress turn into an actual problem? When does it lead to burnouts? And I guess it probably becomes more burnout when it starts impacting things in your life. So, I mean, like, systemically, like for your body, it can lead to things like lack of sleep. It can lead to chronic illness. It can lead to migraines and headaches and things like that, or chronic fatigue. For your mind, it can lead to you constantly worrying or having indecision or negativity about your job or forgetfulness. As far as your emotions, it can lead to depression, irritability, loneliness, hopelessness, anger, apathy, things like that. And then if you're having any behavioral, changes, loss of appetite or lashing out or, alienating yourself from people around you, I would say that's probably signs that it's beyond normal stress and probably turning more into burnout or exhaustion.
Hmm. Hmm. Yeah, so just in your paper, it talked about all the negative things that happen because we are so because when healthcare providers are burnt out, and you cited that 35 to 50% of healthcare providers are experiencing burnout, which is
Hmm.
twice the rate of non-healthcare providers. And
Yes.
in my research, I found that to be the case of both practitioner providers as well as staff or team members or nurses or ancillary healthcare providers. And I think in many ways, there's aspects of healthcare providers who experienced it particularly coming out of 2019, 2020, 2021, because of the additional healthcare burden and the amount of struggles that we went through, as well as non-healthcare providers dealing with struggles in that arena. But
Hmm.
let's dig into this study and what you found out. So you coined up with several other incredible clinicians to work on this paper, a huge survey. If there's 40,000 eye care providers and you got nearly 1,500 of them to respond, that's
Yes.
huge.
Yes.
So obviously, props to you on that. So tell us a little bit about the study, and then let's dig into some of the results.
Yeah, so we distributed this through many different sources, namely through the American Academy of Optometry. They're our primary method of distribution, but we also posted on ODs on Facebook, ODs on finance, corporate optometry, through the Ocular Wellness and Nutrition Society. We were trying to get a wide range of optometrists and different practice settings. So not just get people more in academia. And I would say kind of the highlights of our study is that optometrists are really burnt out. About 54% of optometrists report symptoms of burnout. That is really at the highest levels in healthcare. So, healthcare is already affected more than other professions, and optometry seems to be kind of the worst end of that. So, with more than half of us experiencing symptoms of burnout, females experienced burnout symptoms much more than males. So, about 61% of females, 41% of males. Interestingly, those without children had more burnout than those with children. If you were married or had a significant other that is also in healthcare, it actually decreased the likelihood that you were burnt out. And then those earning less than $200,000 a year had more burnout. But there's no differences in burnout by race, marital status, or region of the US.
So, you went through those very quick. So, if you make less than 200, it was worse.
Correct.
And, being married didn't affect it.
Yes, being married didn't affect it unless your spouse or significant other
Was
is
in
in
healthcare.
healthcare. Then that actually decreases the likelihood that you have burnout symptoms.
And having children reduced your risk, or reduced the number. So, I would say that there's a couple things in here that may, be a little bit counterintuitive to me.
Sure.
One is people who are making a little bit more money may be perceived, and forgive me for those of you who are making less than 200,000, but, it may be that those people are seemingly working really hard. And if you
Hmm.
get paid more because of the harder you work, or you're in a really busy clinic, obviously there's exceptions to that. But presumably, people who are in that higher rate, maybe practice owners, if we look at the wage
Yes.
scales across our practice. And I would see that if you're a practice owner, particularly at the time frames when you did the survey, practice ownership was really hard.
Hmm.
Having kids may put more pressure on you when you go home at night. You've got less time to yourself. That seems counterintuitive.
Yes.
Um, yeah.
Addressing the kids one though, that was a very controversial finding, and the reviewers did not like that, and they made us try to justify it as much as we could. But there's not a lot of research on this. But I will say, having three kids myself, when I go home, I can't be thinking about work because I am totally with my family, my twin infants, and my 5 year old, and like I have to separate from work because I am with my children and they are so much to deal with that I'm not really thinking about work. So and this is there's a difference between professional burnout and home burnout, because I think you can have home burnout too.
Sure. Yeah. Very interesting. Um, what do we think? I mean, because we're removing the married versus non-married, that doesn't affect it. And we're removing the children from the equation. Uh, what do we think about the gender difference? That's a 20% swing. Why are
Yes.
females more burnt out than males?
So I would say we don't have the answers as to why. All we know is that it exists. So the first step is figuring out, does it exist, which we figured out it did. And then trying to figure out the why, I think, is a harder question. But we actually did a follow up study on this that I don't know if you've seen or not, but we explored specifically that exact question. So, what are the gender differences in professional well being? And sadly, women don't fare very well. So, female respondents actually reported worse burnout, job satisfaction, job stress, less control over their workload, less time for documentation. They didn't feel that their values aligned with leadership wherever they work as much as males. And they reported worse team efficiency as well. So And actually, every single thing that we measured in our survey, females fared worse than males.
Yeah. I my 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 team actually got me that study too, and that
Oh, they did.
exploring gender differences in professional well-being among U.S. optometrists, and
Yes.
that was first authored by Emily, and of
Hmm.
course you're
Emily
included
Hour.
on this. Very, very cool. Yeah, so a lot to dig in with that, and a whole study that kind of reviews those things. Obviously, a
Hmm.
very important topic.
I think probably our listeners would like to hear about practice setting, if you don't mind
Yes.
that one, because practice setting is a pretty big one here. Because this is one that we can all relate to because we all practice in different places, but it's kind of you can characterize it as what type of practice it is. So we kind of had three different tiers of in terms of burnout with practice setting. The three
Mhm.
settings that had the most burnout were optometrists practicing in a hospital-based setting, an integrated care setting, which could be like a VA or Kaiser or Kelsey Siebold, something like that. And then number three for burnout was actually optometrists practicing in departments of ophthalmology. So academic, but not optometry school academic. And for me, I'm at number one and number three there. So I'm in a hospital-based setting and I'm in a department of ophthalmology. So that's kind of the first tier that had the most burnout. The second tier was those practicing in a commercial setting, those in an ODMD practice, and then yeah, I guess those two are in the second tier. So a commercial setting and an ODMD practice. The tier that had the lowest amount of burnout were those practicing in optometry schools or in private practice. So be it small private practice, solo, or large private practice. So it was the optometrists in the large private practice that had the least symptoms of burnout. But that was really kind of the order. So from the highest amounts of burnout to lowest amounts of burnout. And then, kind of
Yeah.
as you were saying, people who had done a optometry residency were more
Yep.
likely to be burnt out as well. Let's see; those practicing primary care optometry were more likely to be burnt out. Those were that were mid career, so not early in their career, not late in their career, had more burnout. And then, kind of unsurprisingly, the more patients you see in a half day and the more number of half days of clinic per week, the more burnt out you were.
Okay. So I presume that there is the things that if we could craft the perfect job for somebody and do as many of the things that we could do to either be protective. So number one is have kids. Number two is have either a short or a long commute, right? So like
Yes.
walk through some of the things like what do we do to reduce burnout based on the people that had less of it from the study?
Yeah, so for our study, all we can say is what was protective for burnout and what
Hmm.
was a risk factor for burnout. So the things that were
Right.
protective in our study was being male, having children, having a spouse or partner in healthcare, being early in your career or late in your career. Those with either a short commute, so less than 15 minutes, or a very long commute of more than an hour, earning more than $200,000 annually, or practicing in a location like a private practice or in an optometry school. And then risk factors for burnout, to kind of summarize here, is if you are mid career, the more patients you saw in a half day, the more half days of clinic you had per week. If you worked in a hectic work environment, if you had a commute time between 15 and 59 minutes, and if you earned less than $200,000 annually, those were risk factors for burnout.
Um, dig into that patience in a half day and number of half days. So presumably
Mhm.
10 half days would be a 5 day week, right? Is that kind of how we're gauging that or what?
Yes. I would say that the best data that we have is on the number of clinic days that you have per week. So, for instance, we found that those with severe burnout were seeing patients an average of 4.2 days per week. Those with no burnout were seeing patients an average of 3.8 days per week. And on average, optometrists were seeing patients about 4 days a week. And this actually spoke to me quite a bit. So when I started the study, I was seeing patients 4.5 days a week, and I was very burnt out. When I got this data, I said, you know what? I'm going to cut a half day. I'm going to go from 4.5 days a week down to 4 days a week. And actually, right after we published the study, I said, you know what? I want to cut down another half day. I want more time for research. I want more time to focus on the things that I like, doing studies like this. And I actually went down to 3.5 days a week. And I can say my burnout, even though I'm actually probably working harder and working more hours per week now because I'm doing more research, I can say that my burnout is much better now. And I think that with a lot of patient care, a lot of patients, a lot of time in clinic, as much as everybody that, it can be exhausting. It's difficult to take on patients' problems and to be trying to solve them.
So, yeah, so 4.2 days and 3.8 days, is looking on a little bit closer to 4.5 days and 3.5 days, and the average of 4 days seems like reasonable numbers. What about the patients per day or per half day? How did that work out? Like, what's kind of the right number of patients that we should be seeing if we
You know,
could craft?
that's a great question, and we actually didn't look into specific numbers. We would have to go back through the data to figure that out.
But I think you did say something about the number of patients you saw per half day. Was that?
Yes. All we know is that the more patients you saw in a half day, the more burnt out you were. But we did not parse through the data enough to figure out the exact number of patients in a half day that led to burnout or that lessened the risk of burnout.
Uh-huh.
So, yeah, that's a
Okay.
good question. We should have looked into
So
that.
if somebody said they felt like they saw a lot of patients, they were more likely to experience. And if somebody else was like, no, I see like one or two
Oh,
an hour or
we
something.
did ask. No, we did ask the number of patients you see in a half day. We just didn't delve into that data yet.
Okay. So that
There
that
was
could
quite
be
a bit of
actually a
data that we
really,
had.
yeah, well,
Yeah, so
you sure did. You asked a lot of really intriguing questions, which could really dig into it. And I'm excited for that data to come out because obviously if we look at what's the realistic number, because our profession has been forced to see way more patients if you want to generate way
totally.
more money.
Yes.
And so obviously that becomes a little bit of a challenge if you're far more likely to be burnt out at that higher number, you're risking something. So
Mhm.
very interesting.
Actually, what
Yeah.
we're working on right now that you would probably find interesting is we're looking at job satisfaction. So I'm actually writing a paper right now on, what percentage of optometrists are satisfied with their jobs because there's a very big difference between burnout and satisfaction. There's a lot of optometrists that are burnt out yet satisfied. Um, and I can give you a small sneak peek of kind of one example. But for instance, optometrists in departments of ophthalmology were very burnt out, but were the most satisfied. Practice setting for optometrists. So they're not mutually exclusive. So kind of the latest data that we're looking into is that.
Yeah, yeah, so that how could you make those people even more satisfied is to reduce their
Mhm.
burnout by maybe changing some of those other factors, making a move either really close or way further away from their job could be a scenario. Very interesting. Anything we haven't touched on before I let you go?
Um, I would say if you're an optometrist out there that's feeling burnt out, know that it can change. You're not stuck. You can move to a different setting. You can even stay in the same setting, tweak what you're doing. Try to develop a niche within that setting. We saw that people had niches that weren't just doing primary care, a little bit of everything, but they had a niche in general, had less burnout. You can alter the number of days that you're seeing patients per week. You can alter the number of patients that you're seeing. There are modifiable things that you can do to improve your burnout. And if you wanted to go over any of that, or had any questions, feel free to reach out to me. My email address is calebabbott@gmail.com. I'd be happy to discuss it with you because burnout's a problem that a lot of us face, more than half of us. But you don't have to feel like you're stuck there.
Yeah, yeah, we're kind of our profession has been an OG profession of not focusing on mental health. And
Yes.
I love to see that we're looking at studies and we're looking at analysis of how to make our profession and take care of ourselves, right? First person
Mhm.
you need to put that air mask off on the airplane is yourself so that you can help other people. And we're impacting the lives of millions and millions of Americans. And we don't want to have those additional risk factors for our patients, let alone
Mhm.
for ourselves, right? The more risk of making a mistake and malpractice suits and not providing the patient care. And, we may be giving them the right recommendations, but they can't hear it because of the way that we're presenting it. And all those signs that you pointed to. Great study. I would really encourage everybody to check this out. It's in the Journal of Optometry. It was, just published here in 2025, a great publication, different type of publication than we normally see clinically, and well written, I have to say. A really, really interesting, lots of statistics, lots of numbers, good conclusions that we can take away, and the tidbits that you presented as to what we can really do if you're experiencing burnout is really good. Thank you, Kaleb, for coming and hanging out with us. Appreciate this insight that you not only brought to the podcast, but to our profession. Great to have you, buddy.
Of course. Thanks for having me on, and I'm happy to discuss this anytime.
Yeah. And thank you for listening. Make sure to like and subscribe. Stay tuned next time for more from the OI Show. Well, I've been doing myopia management for 20 years. 3 years ago, we decided to go all in with our practice. And it was at that time that I decided to reach out to Treehouse Eyes and decided to start partnering with them. Over the years, we've been able to implement some incredible team training, some execution with our practice, partnering with them in clinical confidence to understand to make sure that we're doing things the right way. What I'm really excited about is Treehouse has decided to change things up a little bit and start offering a more selective offering. Whether you decide that you want to go full service like we do in our practice, or maybe you want more focused efforts looking at their clinical outcomes, or maybe you want help with your team training or how to execute things in your practice, there's a model that works for you. I wanted to bring up this update because I love working with Treehouse Eyes, but also, if you're wanting to grow your practice in 2026 in the area of myopia management, now is the time to get on board. Check out in the link below the new offerings that Treehouse Eyes has to offer. And I think that we can take myopia to a new level if you can bring a little more precision, a little bit more clinical information, a little bit more marketing to your practice, and if your team can be a little bit better. All of those things can work to make a huge difference in the lives of your patients and in your practice and for you. Check out growmymyopiapractice.com.